Hello, my name is Laura Galicchio, and I'll be talking about the impact of COVID-19 on high school students' mental health. So, over the past few years, we've seen the negative effects that the COVID-19 pandemic has had on adolescents and high school students' mental health illnesses and behaviors. And this is due to several factors, but I've just included three factors I found to be very prevalent among this age group. And this includes social isolation, environmental disruption of school and home life, as well as lack of available mental health resources. And I've also included a statistic here that kind of quantifies the struggle that adolescents felt during this, and they do still feel during this time period, with 36.9% experiencing poor mental health during the pandemic, and during the past year, an even higher rate experiencing persistent feelings of sadness or hopelessness, and then also a significant amount of adolescents considering attempting suicide and also attempting suicide. And I've also included some quotes from adolescents who kind of spoke about their mental health struggles during the pandemic. I've also included some statistics that show the rates of mental health illness among adolescents kind of pre-pandemic, as well as that first year of the pandemic when it kind of skyrocketed. And obviously there's a huge difference in the rates and an increase in diagnoses of anxiety, depression, obsessive compulsive disorder, ADHD, and other conditions such as those. And then we also saw, a significant increase in suicide rates among adolescents and high schoolers, and as well as increased emergency department visits and inpatient visits for mental health in general. And then I just wanted to mention too that prior to COVID, there was already an increased rate of mental health diagnoses in this group, and then COVID hit and it kind of just worsened everything. So then we can also look at this public health problem with social determinants of health, and I included a picture of this model here, and I also included kind of the highlights that this issue's had with in terms of economic stability, healthcare access and quality, as well as social and community context. And as for economic stability, we see that during the pandemic, there is several job losses and food insecurity, and this was also more prevalent among certain adolescents, different race, ethnicities, and socioeconomic status also had an effect on this. And then we also see how low income families experience greater risks, thus causing more severe mental health problems. And then from social and community context, we see the physical and emotional abuse from caregivers increase during this time period, with 55% of youth reporting experiencing emotional abuse by a parent or caregiver, and then also increased screen time with exposure to social media. And this also lessened like a decline in physical activity, which both of these have shown to increase the risk of depression. And then we also see healthcare access and quality with race, ethnicity, education level, and socioeconomic disparities in the type of mental health care that was given, and also just general access. We could also view this problem with the social ecological model, which kind of just shows how all these levels interplay with one another and have an effect on one another as well. So these are all, from each of these levels, we show things that kind of help mental health within adolescence, whether that's by teaching, skills and techniques to these individuals to handle stress, through supportive relationships, increasing mental health supports in schools and other organizations and communities that they're involved in, and also from a policy level, the expansion and mobilization of telemedicine that was super prevalent during the pandemic and still, exists to this day. And then also there are actions that hinder the movement of mental health among adolescents. So through negative stigma around mental health and social isolation and loneliness that it caused, also from an institutional and community standpoint, just the shortage of services throughout the pandemic and that removal kind of from social settings also had that negative effect on adolescents. And then as for policy, there was an underfunding of national mental health services, which put kind of a delay on, adolescent mental health services. So these are my 3 proposed interventions that I have created to help improve mental health outcomes of high schoolers and adolescents. So my first one is through a mental health wellness elective, and creating this for students that address mental health and teaches students ways to cope with stress using CBT therapy, which has been clinically shown to increase positive efforts of mental health, and to kind of have that healthier aspect, and having exposure techniques that review traumatic events such as COVID, and finding those stress management relaxation techniques, and reframing trauma in general. I've also included the materials needed for this. And we also have Rap Club, which was also something that was based off a Baltimore school system. They adopted this idea as kind of a club that connects students to mental health networks in their community and provides space to kind of talk about these things and reduce that stigma in general. And they found that it really helped students during the pandemic who, were taught these ways to kind of deal with this trauma and stress. And then we also have the mobile application RxWell, which is an application that you can install on your phone or computer, and it educates and promotes mental health services to students who are 14 years and older. And this is something where they'd have 24/7 access to mental health services and are able to build healthy habits and coping techniques, and also connect with mental health coaches through the app as well. So kind of promoting that within school systems, I think would be a great idea. And then also for measuring the success of these, we could look at it from a short-term, medium-term, and long-term outcomes. And for this, so for short-term, these are the things that we'd kind of collect in the beginning of these evaluations. So these can include surveys or questionnaires, interviews, things like that, where we can kind of get a grasp on adolescents' changed attitudes, knowledge, and opinions after this evaluation or after this intervention has kind of taken off. And then from medium term, we collect this more deeper into the intervention, and this includes a greater change of behaviors, practice, decision making, policy, social action, and organizational change. These are kind of bigger changes that are occurring. And then that also leads us to long term, which are things we see implemented in more like the community environment and socially, economically, environmentally, etc. So these can be seen obviously in changes throughout the school or community that have taken place to improve mental health outcomes. So potential challenges and barriers that may come up for these interventions. So a poor vision or lack of strong objectives kind of creates that poor image of an intervention. So just having smart goals to help prevent that is something that could help. Creating those measurable and timely goals is a great way to create strong interventions. Also having limited resources, and a way to, find a solution to that is through fundraising in the community and kind of, promoting mental health in general and trying to, get more resources available for that as well. And then also just a possible challenge could be interest in the topic, and getting those participants and adolescents to be interested in this, in these interventions, due to the stigma kind of attached to mental health. And a way to solve this could be just further education to participants and high school students, as well as their parents and in the community, just to kind of communicate the intentions of these interventions, and to kind of open up that conversation about mental health and its importance, especially in a time of COVID-19. And then also a possible challenge could be engagement from stakeholders. So this is, a super important part of these interventions, is to kind of collaborate with outside community networks who are also interested in improving mental health outcomes of adolescents. So that kind of goes into partnership and collaboration. So my job in this intervention is one of the researchers. So for this, I'll be doing background research on mental health trends in specific communities, since every community's, adolescence and culture will be a bit different. So having that information, I think, is crucial before placing an intervention within a system. And then also interventions going on in other states. I think that's important to research and look into and see what other successes communities and states have had, and also just collecting quantitative and qualitative data throughout these interventions. In addition to me on the team, we'll also have other public health professionals such as educators, EPIs, policy specialists, program manager, and public health informatics, and just kind of work together to create that holistic intervention idea and get all our ideas kind of collectively together. And then also community partners are super important for these interventions, and partnering with licensed mental health professionals and other agencies and organizations within the communities who focus on mental health and adolescence in general. And then also school counselors are important, and training our staff to be aware of these interventions as well is super important. And then also, of course, bigger organizations such as the Department of Health to keep data on track and to kind of see the outcomes of that. And then parents and community supports is also super important. And then this is just a logic model here that represents the inputs, activities, outputs, outcomes, and impact of these interventions. And that is all I have. So I hope you consider these interventions in our efforts to increase mental health support for adolescents. Thank you.